Welcome to Medicine Handy Point. Today we will discuss how to take history in a patient presenting with palpitation. So, as usual, we will always start with the onset. When did it started and for how long the patient is having the palpitation. Then we will ask the patient what does the patient mean by palpitation. So the patient will describe whether it is a racing of the heart or whether the patient is feeling pounding sensation in the neck, which usually pounding sensation in the neck usually occur due to atrioventricular blocks. So if the patient is having some kind of heart block, the patient will feel pounding sensation in the neck. And then we will ask whether these palpitations are regular or irregular. So regular and irregular will be our next question. Then we will ask which thing precipitate these palpitation, like exercise, stress, coffee intake or tea intake, and alcohol intake. We will ask about that as well. Then we will ask which things make these palpitation better or aborted. Sometimes the patient learned how to abort the palpitation, especially SVT, by doing Valsalva maneuver or taking deep breaths. So we will ask about that as well. And then we will ask about associated symptoms due to palpitation. So we will ask about dyspnea. Usually in the patient with arrhythmia, there will be associated dyspnea. Then we will ask about chest pain, nausea, and sweating, which are usually associated with myocardial ischemia. So we'll ask about those as well. Then we will ask about exertional dyspnea, orthopnea, PND, which suggests congestive cardiac failure. So sometimes congestive cardiac failure present with a palpitation. Then we'll ask about whether the patient is having syncope or syncope during the episode of palpitation. Then we will ask about fever, whether the patient is having any fever or no, because fever can lead to palpitation. Then in the next step, we will then dig out what could be the cause of palpitation. So we'll start with endocrine problems. So we'll ask about symptoms of hyperthyroidism, hypothyroidism, hypoglycemia can present with palpitation. Then we'll ask about symptoms regarding pheochromocytoma, because pheochromocytoma can present with palpitation. Then we will ask about cardiac condition which can lead to palpitation. These include ischemic heart disease, congestive cardiac failure. Non-arrhythmias can lead to palpitation. Valvular heart diseases like MS most likely lead to atrial fibrillation, and that can present as a palpitation. Then we will ask about congenital heart conditions like ASD, VSD. They can present with palpitation. Then we will ask about respiratory conditions which can lead to palpitation, like COPD, asthma. These patients, because they are taking beta agonist drugs, so that can lead to palpitation. Then we'll ask about psychiatric conditions like anxiety, panic disorders. They can lead to palpitation. So we'll touch upon the etiologies. Then we'll ask about the complication of palpitation, like sometimes atrial fibrillation present as a palpitation. A patient will present with a stroke. I will ask about syncope, because arrhythmia presenting as a palpitation can lead to syncope. Then we will ask about family history of two conditions, especially hypertrophic obstructive cardiomyopathy and long QT intervals, which are inherited. So in a family history of the history, we will ask those. Then we'll ask about the medication which can lead to palpitation. These are beta agonists, theophylline. If the patient is having asthma on COPD and taking those, if the patient hypothyroid and taking levothyroxine in excessive amount can lead to palpitation. We'll ask about antihistamine, which can lead to basically QT interval prolongation and cause palpitation. Other drugs which can cause QT interval prolongation and palpitation, they are macrolide, antiarrhythmic medication, antipsychotic, SSRI, antidepressant, and GA motility drugs like domperidone can also cause palpitation. So we'll ask about those in the drug history. Then there are social history. We will especially ask about smoking because it causes ischemic heart disease, can cause palpitation. Alcohol is directly toxic to heart connective tissue, causing palpitation. Cocaine again, sympathetic mimetic type of actions causes palpitation. Amphetamines, these are also having sympathetomimetic actions and can cause palpitation. So this will cover almost everything regarding palpitation when you are taking history from a patient with presenting with palpitation. I hope you liked the video and please subscribe to the channel.